wanted to do a video about something that I have always wanted to do a YouTube video about. And it is the topic of mental health. Young people's mental health is something that I'm quite passionate about. And I'm guessing this is probably because me and mental health were introduced to each other at a very young age. Although I didn't know the term mental health, I was introduced to the word depression. This is the first kind of thing that I knew about. So in other videos, I've said that I wanted to cover this topic before. I'm guessing some people are going to be thinking, why is she covering it now? What are the reasons behind this? Instead of saying what are the reasons for me talking about it, because all I can say is that it's just something that has always been around me, if that makes any sense. But there are two reasons why I have never done this video, and this is why it has taken me so long. Initially, I wanted this video to be my third or fourth video that I ever put up on YouTube, but again, I was a little bit worried about putting it up. Reason number one. My first reason was judgment. This was the judgment of my family, friends, people I work with, people who don't even know me but know me around the area, know me to see. I was just really worried about people judging me. A lot of people think of me as this happy, positive, smiley, cheery person. And I really like that that's the image that I am portraying to people. But that's not always who I am. I feel, personally, that I don't want this image to be broken of me. I don't want people's judgment. I don't want people pitying me. I don't want people looking at me in a different light. I don't want to smash this image of myself as a happy, cheery person. And it's kind of scary to come out and say, actually, that's not me. I am putting this on a lot of the time to seem normal, because in our society today, that's what normal is. Normal is getting on with everything and being okay. One of my favorite quotes recently is, "It's okay not to be okay," and I'm trying to live by that, and that is why I'm trying to make this video, because it is a bit scary to come out and say, actually, I'm not okay 100% of the time, and we've got to be cool with that. My second reason is mainly on the platform that I am putting this video up, and it is YouTube. Basically, I don't want people thinking that I'm just thinking that mental health, anxiety, depression, OCD, anything like that is a hot topic and I am jumping on the bandwagon. That's what I'm worried about. I don't want people to think I'm doing this video just for likes. And I will put my hands up. I have to be honest with this because it's the only way that I can explain myself clearly. I see some titles of videos, I watch some YouTubers, and I see them making videos surrounding mental health, and I feel you were just trying to check the boxes around getting subscribers and getting views. Because we all know out there seems to be set videos that if you're covering them, you can relate to more viewers and more subscribers will come to you because you're so relatable. And I'm just worried that people are thinking that I'm trying to do that, because sometimes, and I know it's wrong, I think that about people. My 4 years of nursing, there was one quote that has always stuck by me. It's by McCaffrey, and it was in 1968. That is how well I know this quote. I even remember the citation. McCaffrey, and it was talking about pain, and it said, "Patient's pain is whatever the patient is experiencing." And I shortened that down to, pain is whatever the patient says it is. And that is how we should be reacting to these mental health videos. You know, if some girl comes out and she says, actually, yes, I have severe OCD, or some boy comes out and he says, I have really bad anxiety, we need to realize that this is their level of what they're feeling. So we can't really judge and say, you know, he's worried about going into a room full of people and talking to 10,000 people, yet he does it. So he can't really say he has anxiety, but he might have anxiety about something else. That might be a moment of being okay with it. And I know it's just not okay to judge people about things like this. And I guess I've just thought a lot about these type of videos that YouTubers are making, because I am in two minds. That's four. I am in two minds. One, I think it's great that people are making these videos and it is being okay not to be okay, because these big YouTubers and YouTubers at all are saying this is this is what's wrong with me, this is what's happened. But I just worry that young, impressionable people will look at it and say, this girl has anxiety just like I do, but she's living this most perfect, wonderful life, and look at her doing these amazing things. I just must suck even more because I just must be really badly dealing with my anxiety. You're kind of relating to them, but then you're putting yourself down because you're like, I'm not dealing with them, look at them dealing with it. It's kind of like how Hollywood celebrities will come out after they've had this mental health illness and they'll say, oh, I was bad, but I'm so much better now and I've got so many more things going for me, but I did have a bad time. It makes it really hard for people to relate to that. And that's how I kind of feel like with the mental health issue around YouTube and around anything like this, is that you have to remind the viewer that, you know, this is just my camera life. You are not seeing 100%. And I know so many YouTubers have said that in so many videos, and they've tried to tell their viewers, you are not seeing everything. But it's really hard for us as viewers. There's vloggers that I watch and I still think, oh my god, their life is amazing. And it's really hard to remember, you're only seeing a percentage of their day. Which kind of leads me on to what I think people will be asking, and what I ask definitely is, if you have such bad anxiety or depression, how the hell are you on YouTube? And my thoughts on this, and I want to know what you guys think, is that it's in a controlled environment. I've set these lights up. I know what's behind me. It's just me and the camera. I've set the angles right. I know what I look like. I've done my makeup. I've done my hair. I'm in control of how I look and what I say. And even at the end, I can edit it, or I can throw it in the bin. I can upload it. I can do whatever I want with it. I've actually had to move because the camera ran out of battery. So if I'm blurry at all, I don't have anyone to fix me in. So I apologize. But to end, I think the best way of dealing with mental health in young people and just mental health with everybody in general is that we need to get rid of this stigma. This just seems to be one of the biggest blocks with mental health, is this stigma. So maybe as well as celebrities, as well as YouTubers with millions and millions and hundreds and thousands of subscribers, maybe it's just a little guy who only has 100 subscribers that needs to come out as well and say, yep, here I am. I think we need to be honest with ourselves, and we need to be honest with others and come out and say, yep, I'm not doing so well, and I guess that's what I'm here to do, and hopefully do a couple more videos surrounding things like this and this topic, and help in any little way that I can. Thank you for watching so much. Hopefully you will be seeing this on YouTube and I haven't completely chickened out. Okay, bye.